Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.
Hello and welcome to the Counselling Tutor Podcast with me, Rory Lees-Oakes, and with me, my fellow wingman in everything therapeutic, Mr. Ken Kelly. How are you doing, Ken?
Exceptionally well today, feeling good, ready for episode 95, and it's a good episode. I think that it covers a broad spectrum in terms of it doesn't matter where you are in your study journey. Even if you're a qualified therapist, you're going to get something out of episode 95, kicking off with what level you need to reach to be able to call yourself a qualified counsellor and start counselling. In practice matters, a really important subject, working with clients who have a formal mental health diagnosis, Rory.
Yeah, and I'm going to be speaking in that section about seeing the person, not the label, but more importantly, the difference between judgment and assessment. And that's something that you may need to use if you have someone who may be becoming unwell due to the fact they have difficulties with their mental well-being.
So of the time, Rory, only just recently in the UK, at the time of recording this, the budget went out. The government put their budget together and they've allocated a lot of money to mental health. And we're going to be seeing more and more people with a formal diagnosis appearing in our counselling room. So looking forward to Practice Matters today. And then ending episode 95, we're going to be speaking about a topic which I guess for some people is a difficult topic to even hear the topic, and that is working with sex offenders. Can you work with a sex offender? So we're going to be covering that topic at the end of today's episode. But kicking us off, episode 95, starting with what level means that you can call yourself a qualified counsellor, Rory?
Yes, so my post bag is full and our Facebook page is full, or it comes up time and time again. And if you're thinking, well, what Facebook page is this? If you type in Counselling Tutor into Facebook, you'll find our closed group, over 20,000.
Woohoo! 20K. It's loads, isn't it?
You're all right there, Ken.
I am. 20,000. I'm celebrating. That's a lot of people. I'm thinking, when you talk about how many people are on our Facebook group, I think of them packing a football stadium. It's a lot of people.
Yeah. Counselling United, we should call them.
I like it. You need to join that Facebook page, don't they, Rory? How do they find us? They go to
Facebook, they type in Counselling Tutor with two L's in counselling. We're a closed group, but we're a friendly group. Just knock on the door, say, I want to join, and either myself or one of our moderation team will let you in, and you can join this wonderful, vibrant group of people, all on their journey. There's some students, lots of students who are studying like you. Yep. There's also qualified practitioners, maybe like yourself, supervisors, and we've got quite a few lecturers and teachers in who are really helpful. So, yeah, it's a very vibrant group. So, yes, this question gets asked a lot in our Facebook group, what level's qualified? So it's really, really difficult to understand it if you don't know one key component. And I'm going to share that with you. There's lots of different levels. So generally speaking, in the UK, I'm talking about level 2 is the equivalent to a GCSE. Level 3 is the vocational equivalent to an A level, and level 4 is the vocational equivalent thereabouts to the first year of a degree. Level 5 is the second year, and level 6, the research part, is the third year of a degree. So if you do a degree, you're doing effectively 4, 5, and 6. It goes up in academic challenge as you move through those 3 years. Now, here's the thing: what level are you when you get your qualification? Are you qualified at? So let me ask you a question, Ken. You've got a degree in counselling, and you decide to become a counsellor. Do you think with a degree in counselling you could be a qualified counsellor?
I would like to hope that I would, with a degree in counselling, be able to be a qualified counsellor. Yeah. But I can see there's a trap here. I can see the ground looks normal, but I bet there's a hole being dug and you've covered it over with grass, Rory.
Well, it depends on what qualification you do. This is the key thing. Now, the key aspect, and if anything I want anybody to take away from this, is that the only qualification that is worth anything is one that has 100 hours of supervised practice. In other words, you go out into a placement, you work with clients, and you're supervised in that placement time over 100 hours. So that's the first thing. The second thing is that your course, when you qualify, you're able to join an ethical body. So what I would do is, if you're looking at a course, is I would contact an ethical body, the BACP or the NCS, the National Counselling Society, the British Association of Counselling Society, and ask if they would take you on as a qualified counsellor if you pass that course. Now, online courses, really, at the moment, you could get yourself a level 4 in counselling online, and you wouldn't be able to join an ethical body. And if you're looking for employment, you have to join an ethical body. So the key aspect is that 100 hours, and also the ability to join an ethical body, whether they'll recognise your qualification. So that's the key thing. Now, to answer the question directly, what level? Level 4 is considered qualified. So at level 4, you could go out, as you did, Ken, and set up in private practice.
Yep.
You could be a private practitioner. You may have to be thoughtful of the clients you take on, because you'd be really at the beginning of your practice journey. But there is absolutely no reason why you can't set up in private practice. I know some people say, you should have level 5 to go into private practice. That's not actually true. You can set up at level 4. You may want to do a level 5 if you want to be super sure that you're going to be offering the best service to your clients, because level 5 qualifications usually focus on working as a private practitioner.
100%.
So in summary, because that's what we do as counsellors, we sum up, the minimum qualification is level 4. It has to have that element of 100 hours of client contact that's supervised. An ethical body has to recognise it, and absolutely no online courses. So there's the answer to that, and I hope that demystifies it. But I'm going to guess that they're going to be asked again and again. That question comes up again and again.
Well, I can see me sending the link to this podcast, Rory, out in some support requests and popping it on the old Facebook page when people are asking about this. And what you're saying there is 100% correct. It's about the supervised practice hours, 100 minimum of 100 supervised practice hours, and that would be done while you are still under the umbrella of your learning institution, your university, your training college that is teaching you. You will be in a placement. There will be a contract in place between your learning institution, between your supervisor, and you are supported through 100 hours of actual practice where you call yourself a placement counsellor. And that is the shortcoming of the online course. There is no online course where that is provided for. And hey, you know what? The technology is changing. There may be a day, Rory, that we revisit this podcast and say, there are certain online courses where you can qualify to practice. But as it stands at the moment in the UK, according to my knowledge, according to your knowledge, Rory, that cannot be done. So it's those practice hours. That's the magic ingredient.
It is. I can remember a couple of years before I left teaching, someone phoning me up who had a degree in counselling, and the client contact hours were 40 hours. So they qualified, they got the hat, and all their relatives turned up, and big celebration at the graduation. Then they went off to an ethical body and said, I'd like to join the ethical body. And he said, how many hours have you got? And he said, 40. And he said, not enough.
Yeah. It is very, very, very sad. I know many people do an online course hoping that they can go into practice, because they go onto the online course and sometimes they are described woolly and they don't give you all the information that you do need. And the problem comes, like you say, Rory, joining an ethical body, and without having membership to an ethical body, you cannot get practice insurance. There are no employers that would consider you to work within their agencies if you are not a member of an ethical body.
Absolutely. And that's the key thing. And what happens is you qualify, as I did, and then you do what's called the COP, the Certificate of Competence, the Certificate of Practice, which is like a little test. It can be done at home now. When I did it, I had to go to a hotel, and there's lots of us with computers, but you do it from home. And once you've passed that certificate of competence, then you're awarded a little kind of mark, little kind of badge with a registration number on. And that's what you put on your website. And the difficulty we have in the UK is that counselling isn't regulated, so there's no government regulation. So it's a voluntary register. But what I would say is that the general public are really smart. They know exactly what they're looking for. That's my view of it. The little badge I have on my website for my own private practice clearly shows that I'm a registered member of an ethical body. I'm open to audit. I'm open to a complaints procedure if that happens. And also I abide by the ethical body's guidelines of continuing professional development every day for me, and also regular supervision. So, be very careful and ask that question. Does it have 100 hours of client contact, externally supervised? Doesn't have to be externally, can be internally. And also, can I join an ethical body? And if you're not sure, contact the ethical body.
100%. And just to kind of qualify what we're saying here, there are many steps to becoming a counsellor. So if you were doing a level 2, an introduction to counselling, you would not expect to do any client hours. On a level 3, a certificate in counselling skills, you would not be required to do any client hours. You cannot qualify with a level 2 and level 3. So if you're looking for a course and you listen to this and going, oh, it has to have those 100 hours, that's only when you get to level 4 and above that you need those. So what you would be looking there at progression, there's loads on counsellingtutor.com. Go to counsellingtutor.com. We've got a little search bar there. You can put in information, awarding bodies. That will bring up information on awarding bodies. Which course should I choose? Put that in. We've covered that in a podcast as well. So there's a lot of information on our site to help guide you with that. Great topic, comes up again and again and again. So moving away from what it takes to be qualified, moving on to being qualified, at least in placement, or a qualified therapist, and you're in practice and somebody is referred to you, or they come through via a private practice route and they mention to you that they have a formal mental health diagnosis. That's what you're going to be covering today in Practice Matters, Rory.
It is. And I've always taught and believed that assessment is something we should be doing all the time. We should be keeping an eye on assessing our relationship with our client, and also making an assessment whether our clients, and this is crucial, is in psychological contact with us. That is the essential. They need to share equal and present time. Now, I've worked in mental health services as a support worker with people who've had mental health diagnoses where they become unwell, they do not share equal and present time. They become delusionary. They may become very paranoid. They may become very unwell, physically and mentally unwell. And one of the things as a private practitioner is that I try, if someone has a mental health diagnosis, I just try and find out what well is for them and what happens when they become unwell. So I can then work with an assessment, because if they turn up in the therapy room and they're clearly unwell, then I have to take a view of how best to support them. That's assessment, not a judgment. But I will be talking about working with the person and not the label, seeing through the label, seeing the person, as I like to say, sticking with the knitting.
Let's pick up with Practice Matters after this short message.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
It's not unusual for counsellors to meet clients who have a formal diagnosis. They may have visited their GP and spoken about what's going on for them, that they're feeling in low mood or feeling anxious or feeling disconnected with the world. And with that, usually the doctor makes a diagnosis, and with that can offer a number of services. Sometimes it's medication and sometimes it's a referral to counselling. In these enlightened times, or certainly more enlightened times, a lot of GPs are trying to streamline people to counselling services as opposed to putting them on medication immediately. It wasn't always the case. When I first started counselling, it was almost a default to put people onto medication. But it does beg the question, how do we work with clients who present and tell you they've got a formal diagnosis from a doctor? Because sometimes the diagnosis can be a way of putting blinkers on the counsellor. They may see the client as the diagnosis, not as an individual in their own right. And as I kind of always say, we need to drop the label and see the client. We need to see who they are individually, not just in terms of a diagnosis. It's one of the things that separates us from the medical model, which traditionally saw people as an illness. In the social model, of which counsellors practicing, that sees people as a product of their experiences and their surroundings and their interactions with the world. So, are there any kind of observations that can be really useful? Well, I think the first one is don't assume. Everybody experiences themselves differently. Bipolar, schizophrenia and depression can mean different things to different people. Not everybody who's schizophrenic hears voices. So that's the first thing that's really useful to know. Not everybody who is depressed experiences it in the same way. So we need to stay clear of labels and actually see the person. So the first is don't assume that someone is feeling like they are because of the diagnosis they share with you. The second is to be curious and ask the question, how does your diagnosis affect you? This question is crucial because it allows you to understand your client's frame of reference. It allows you to understand how the client feels, what's going on for them, and I think is a really useful starting point in starting the relationship and also starting the work, finding out what may be affecting the client and what things the client may want to change to make themselves, for want of a better word, happier in the world. Working collaboratively is also very useful for clients who've got maybe a long history of mental illness. Sometimes it's very useful to ask them how they feel and to use the relationship to gain understanding of how you can work together. Always, with any client, it's what works for them. And that's the frame of reference I come from. How can I help you? What can I do for you? And certainly someone who may have had a long struggle with their emotional or mental health may very well tell you what really does work for them. And certainly we know in PTSD, with people who've suffered trauma or experienced trauma, that staying away from things that are triggering is immensely helpful. Hopefully gone are the days where therapists blunder in and get trauma clients with trauma to talk about the actual event. We go at their pace and speak about what they want to discuss and work collaboratively with them. The other thing I find really useful is what does unwell look or feel like? One of the things I learned as a support worker when I worked in mental health was to try and get a sense of where the client is when they're well. Not everybody is unwell all the time. And if someone is well, you can ask them, what does unwell look like? And they may very well tell you. They may say, I become withdrawn. They may tell you that they feel very anxious and have difficulty talking to you. They may, in some cases, say that they have kind of very manic episodes and tell you what that would look like. So it gives you a real sense of who you are dealing with in the here and the now. And it also gives the counsellor a very, very useful tool, an ethical assessment of whether they are working in their professional competence by asking clients, what does unwell look or feel like? If a client presents and they're clearly unwell, if they're going through a manic stage, or if they're really clinically depressed, or really, really anxious and having flashbacks, it gives a therapist a really good gauge to whether they're working within their competence. Because clearly some people may become so unwell, they actually may need some medical help. The other thing is be aware of psychological contact. And there's a world of difference between assessment and judgment. As I said earlier, sometimes you may have to assess if a client's becoming unwell. when you're in the session with them. And psychological contact is one of the key assessment tools of that. If someone is disconnecting from you and is not in a shared reality, then there's a good chance that they may need another form of help, and you may have to access a different form of support. And there's a whole difference between judgment and assessment. Assessment is where you're thinking to yourself, can I work effectively with this client? And more to the point, is this client still in equal and present time with me? Are we sharing the same reality? And if you're not, then you have to make an assessment of whether you can work with them. A judgment is effectively looking at a label and thinking that someone is schizophrenic, bipolar, depressed, anxious, and seeing them only as that. So, to summarise, always see the client as an individual first and foremost, but be aware that if they share a diagnosis with you, it's always a good idea to get a sense of what that means to them and what well and unwell look like.
Thank you as always, Rory. Such an important topic. And my takeaway from that as counsellors, we are likely we work within mental health and well-being, so we are likely to have people that present with a diagnosis with a mental health diagnosis, or people that may be on the road to a diagnosis. Of course, we're not there to diagnose, but we are there to work with the people that present for counselling and check our own competence of whether we can do that. So you can get Rory's super duper handout from Practice Matters, and that's completely free of charge. And you can get that by going to our website, which is counsellingtutor.com. That should be in your favourites bar. That should be counselling spelt with 2 L's because we're based in the UK. Counsellingtutor.com. At the very top of the page, you'll see the menu. Just click on podcast and make your way to episode 95. Episode 95, you'll find all the show notes from today's episode, any links we may have mentioned or come up with after the actual episode goes out, and you will also find the link to Rory's super duper handout that we will send you. You just put in your email and we will send it to you. However, if you are already a member of our paid for resource, which is called the Counselling Study Resource, well, that handout has already been added to your Counselling Study Resource dashboard. In your handouts vault, just log in and you can get it and download it from there. It is stored there for you for whenever you need it. Also wanted to mention, if you are a member of the Counselling Study Resource, Rory very recently did an amazing lecture on differing models of mental health. You'll find that under the theory section. So you'd go to Lecture Library, Theories, and just scroll down, differing models of mental health. It is a comprehensive lecture on what to look for and how to prepare yourself for working with people who may present with mental health issues. But we're moving now on to a topic working with sex offenders, Rory.
Yes, and in my 10 years of teaching, one of the things that we used to do on every course was do a hopes and fears exercise where people shared their hopes and fears. Certainly on the level 4 course, the practice-based course, one of the fears that came up was that they'd work with someone who was a paedophile or a hebephile, and there's a bit of a difference. Paedophiles are people who are attracted to children. Hebephiles are people who are attracted to teenagers, effectively. And it was always a worry. But the fact of the matter is, you may very, very well have a client who may just disclose that they've got a sexual offending history. And what I wanted to do is really talk about how you might want to think about working with that kind of a client with that kind of history. And the first thing I would say is you need to understand your own history, because if you've had a history where someone has abused you, this may really, really, really cause a lot of transference. You could end up in a real transferential mire, and you could really become quite distressed with it. So I always think it's a really good idea, if you are going into a placement, to actually say to your placement provider, there are certain people I can't work with. And a good placement provider would honour that, in my view. I, as someone who used to kind of manage placement therapists, if someone said I can't work with that presentation, I would be really pleased that they said that, because that would save a lot of difficulty further on down the road for the therapist and the client. And also, for those who work in prisons, I know there's a lot of people who do some really great work in prisons, and you're likely to come across people with a sexual offending history in prisons. And I'd like just to share you a bit of an insight with someone who's a really good friend of mine, someone I've got a lot of time for. And she recently said to me, I'm working with a client, she's a therapist, I'm working with a client who's a sex offender. And he told me about 5 or 6 sessions in, and if you'd have told me that was going to happen before I met him, I wouldn't have met him. However, she said she was really surprised at her ability to work with this person and offer unconditional positive regard. It doesn't mean she agreed with what he did, but she could see the whole person, not just the offence. It is a big ask. I know there'll be people listening who may be saying, I couldn't do that, and that's really fine. But I think that if we offer therapy, we should offer it to everybody. That's my personal view. And I think it's a case of preparing self just in case you come across someone who has a sexual offending history.
It's a really interesting topic, and I think a topic that sometimes because it carries it carries a lot. When you say sexual offender, it carries a weight. Those words carry a weight, and maybe those weighty subjects, those weighty topics, are not discussed enough. They're hidden away. Oh, we don't want to go there. It was really interesting. I was watching a television program very recently called The Last Leg. Absolutely fantastic. Goes out in the UK, and somebody on the show mentioned a person's name. They said the words Jimmy Savile, who is infamous, I guess is the right word, for having been a perpetrator of many sexual offences in the UK. And it was interesting to see what happened with the other panelists. They all shunned away, shrunk, that name shall not be mentioned. And this is not a topic we want to be putting under the carpet. This is a topic specifically as counsellors, therapists, that we want to be looking at, talking about, because you need to identify within yourself, can I, as you said, Rory, can I work with somebody who maybe presents with this? It's a tricky area. So what you've spoken about so far, Rory, are historic abuse, where somebody will maybe have been through the courts of law, maybe have been arrested, maybe be on a sex offenders register, and they're sharing this information. That is very different to somebody who has not been through the justice system, that may mention or disclose harming other people. And that is a very, very different subject. So we need to be very, very clear on that. And you would have in your contracting where you would need to break confidentiality. And that would be one of those instances. I liked, Rory, that you covered in Practice Matters working with clients who have a formal mental health diagnosis. And your main message there was to see the person, not the label. And I think the message here is the same.
It's absolutely the same, Ken, and I think it's just a bigger ask. And I think we need to acknowledge that. There's a lot of fear around working with people who have a sexual offending history. One of my many jobs through the years, I worked in a hostel for men who'd come out of prison, and I met a lot of people who had what was then called Schedule 1 offending, which was Schedule 1 was being convicted of a sexual offence. And they were all human beings. Their behaviour, and that particular behaviour, was absolutely not acceptable. I want to make that clear. But it wasn't all of them, with a few exceptions. And this is the thing, you talked about Jimmy Savile. Jimmy Savile was a sociopath. And as a consequence of that, it was all of him. And there wouldn't have been any therapy under the sun, I don't think, that would have stopped him being as he was, because he didn't have any empathy for others. And a lot of the great work that's carried out in probation services and recovery services is to help people see the impact of their offending patterns on people and to try and get them to understand how it affects other people. That works for some people, but for people with sociopathic who don't really care about anybody else, and Savile's a really good example of that. I think that I think just a deterrent of, if you do that again, you're going to prison for a long time, and And there we go. I'm as guilty as anybody of using a label, I guess, Ken. But if someone who has a sociopathic offending history, I think is more liable and more difficult to work with because they don't think they're doing anything wrong.
Yeah, 100%. And you mentioned something interesting there. You said pattern when you were speaking about the offending behavior. And I have, in my private practice, had a number of occasions where I have worked with people who have sexual offence on their record. And in working with that, and in my understanding and in the CPD that I did surrounding that, there is generally a pattern. And the pattern ends with the acting out, whatever the acting out may be, the action. But directly following that, there is usually incredible remorse and guilt and self-loathing and shame. And how could I do that? Because it is not all of them. It is a part of them. And there is that I can't go on like this. I need to do something about this. Yet I can't tell anyone because this is something I need to keep hidden. And then there is a period of time where that kind of subsides, and then the interest maybe gets sparks again, and it runs on a pattern. It's a very interesting topic, and definitely a topic I suggest CPD on to understand what those patterns look like, and to understand your role within that relationship. Because you want to be working with the person and what they feel. You don't want to be working with the acts. That it's not about the story, it is about what they are left with and who they are as a person.
Absolutely, and you've hit the nail right and firmly on the head, as you usually do, Ken. CPD, this is not something, a presentation to work with without a lot of research, and I would say really, really good supervision. A supervisor who understands the nature of that offending pattern. That's one of the questions I'd be asking my supervisor. Have you worked with people who've been convicted of sexual offending? And if so, draw on that experience. And also just think of your own self. I think that's why personal therapy is so useful. Personal development is so useful to get us in a place where we are resilient with working with maybe material that is very, very difficult to hear.
It's such an interesting topic, and the other side of this is the fallout in the person's life. So if you have a sexual offence on a record, specifically if you are on a register, your life comes tumbling down around you, and you could be working with the person presenting with how their life looks at the moment, how their neighbours, how they had to tell their neighbours, or whatever it may be. So there's a lot to deal there. And the interesting thing is getting a sexual offence charge is not as difficult as it sounds. And I actually saw it happen a few years back. It was a New Year's morning, so very few people around, and 3 lads were obviously dead. They were probably late teens, early 20s. They were obviously dead, maybe after a few too many beers, to streak. And they were walking down a main road, wearing absolutely no clothes, having a good laugh and a giggle, and it was very quickly the police arrived and they were whisked away. That's how easy it is to have an arrest that is based in a sexual offence. It is public indecency. It's not as difficult as it may seem.
It's not, and since I left working in hostels, they've changed the schedules. I believe now there's different levels of sexual offence, and they're categorised, which makes sense in the case of those 3 chaps who were who were walking around with no clothes on. But of course, there are some very serious offending. And the long and short of it is that we run a repatriative justice system in the UK, where we eventually release people back into society. And without access to therapy, it doesn't really complete that kind of covenant we have in our society, which is that we try and integrate people back. We can't lock people up forever. And I know there's going to be people listening to this who said, I'm sure they should be locked up forever, or terminated with extreme prejudice. And, I really hear that. It's not my particular view, I have to say, but I understand that. So it takes a lot of thought. And if I'm honest, Ken, I was a bit reluctant to bring this subject to the podcast because it is one of those very difficult subjects to talk about.
Agreed. And that's what we do at Counselling Tutor on the Counselling Tutor Podcast, is we try and bring all of the subjects relating to counselling, to the study of counselling, being a qualified counsellor. This has been episode 95. We started off speaking about what level you need to be at to call yourself qualified counsellor and to go out and practice, become a member of an ethical body, and to get your insurance in place. In Practice Matters, Rory covered an incredibly important topic, working with clients who have a formal mental health diagnosis. And we ended with that controversial topic of working with sex offenders.
And as always, stay grounded and stay safe.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. Counselling Study Resource, or CSR for short, is the world's most comprehensive assignment guidance and study support resource for students just like you of counselling and psychotherapy. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.